One of the reasons I encourage patients to come see us at Reflection is because our consultations are free and you always will meet with one of our liposuction physicians during your consultation. So there are different forms of liposuction. You can either use just straight liposuction where you only use the cannulas to remove it. You can use a laser where you melt the fat before you suction it, and then you can use the vaser, which is an internal ultrasound that prepares the fat and makes it easier to come out. In addition to that, you can use local anesthesia, which is where you use a numbing solution that you inject between the skin and the muscle into the fat to prepare the fat, and this way people can be awake and don't feel anything during the procedure. The advantage of doing liposuction under local anesthesia like we do in our office is that it's a much gentler procedure for patients. Their downtime is much shorter, their recovery is much quicker. They're right there during the procedure for us to turn them, flip them, stand them up even to see how it looks, and that makes a big difference for most people. General anesthesia presents the greatest risks of the liposuction procedure, and a lot of people feel bad afterwards. They kind of have a hangover. When you do your procedures under local anesthesia like we do in our office, we use a numbing solution that has additional benefits besides the fact that you don't have to use general anesthesia. You can actually reduce the risk of bleeding and therefore bruising, and that makes the recovery period a lot faster and less painful for most patients. It also reduces the risk of infection because it's a little bit bacteriostatic. A lot of patients like that they don't have to go under general anesthesia and therefore don't have to go to the hospital for this procedure. We can do it right here in our office. The fat that gets removed during liposuction is gone permanently, which is very different from when you lose weight. When you lose weight, the fat cells that are there just shrink in size, but they're still there, meaning that when you gain weight, they'll just fluff right back up. Unlike with liposuction, where you actually take them out, however, you have to leave some fat cells behind because otherwise it's going to look funny. If you have skin directly on muscle, it just looks awful. It looks, ripply and wrinkly. So it's important to leave a little layer behind to get a nice smooth effect. If you gain weight, you can increase in size everywhere, including in the areas that we did liposuction. However, it's less likely to go there. It's more likely to go to other areas that we didn't treat where you have more fat cells. Our liposuction doctors are experienced in using different types of liposuction, which means we can help you pick what's right for you. With laser liposuction, people use the laser to melt the fat before you do the liposuction, and that can make it easier to do the actual liposuction. I personally like to use the laser to treat the skin after liposuction to heat it up, and that will stimulate the production of collagen and elastin, and that's how you get tightening of the skin. Phaser is an internal ultrasound that we use before we do the actual liposuction. And what it does is the sound waves kind of shake the fat cells loose and almost liquefy the fat. And that makes it much more efficient when you do the actual liposuction. And in addition to that, the fat cells are its much better quality to use for fat transfer, like in a BBL, for example. When patients come to me, I spend a lot of time trying to find out what it is that really bothers them, and then try to come up with a realistic solution that is going to make them happy and give them the results that they're looking for.